I've already performed hand hygiene and put on new gloves. I've also discussed the procedure with the patient to make sure we're on the same level and she's comfortable. I'm going to ensure privacy by taking this towel and draping it over any areas she may not want to be seen. If this bag was full and needed to be emptied, I would empty it first, but since it's not, I'm just going to start by removing the bag with adhesive remover. I'm going to gently remove it with this remover to prevent any skin peeling or damage to the skin. Once removed, I would dispose of this properly. I'd also perform hand hygiene again and change my gloves. And once I perform my hand hygiene and change my gloves, I'd examine the stoma to make sure it's pink or red. In this case it is red, and check for any damage around it as well on the skin. So in this case there's not, so I'm just going to start by cleaning the stoma with warm water and soap. I'm going to clean on and around it. Once clean, I would measure it with my stoma guide. It should be about 1/8 of an inch larger than the stoma. So in her case, she's at about 35 millimeters. So I'm going to take her new pouch and cut it in between the 30 and 40. Once that's been cut, I would remove the seal and place the barrier cream on it just to make sure it sticks, and it'll give it a little bit of cushion when going on as well so she's comfortable. And then I'm going to place it on around the stoma and hold it for about 30 seconds just to make sure it's fully sealed. Now that it's been about 30 seconds, I just make sure it was closed all the way. We don't want anything to leak out. Now that it is, I would dispose of my supplies properly and clean up my area and also perform hand hygiene and change my gloves.